Hi, everybody. It's Dr. Eric Balcavage, and I'm here with my partner on the Thyroid Answers podcast, Dr. Erica Riggleman from Winchester, Virginia.
Yes.
Right? All right, Dr. Erica.
Hi.
So today, this is our 9th episode of the Thyroid Answers podcast. For everybody who's found us, is downloading us, we really appreciate that you're downloading it, that you're enjoying it, you're learning it. We just hit our 2000th download of the podcast between yesterday and today, so we're pretty excited about that.
Yeah, that's awesome.
Yeah, and we are excited because we're going to be getting some really great guests on the show in the future. And so Dr. Carrie Jones is one of those people we're looking forward to having on the show, and that's one of the reasons we've been talking a little bit about the connection between the thyroid gland and hormones, and definitely the tie-in between the thyroid physiology and cortisol. And today we wanted to touch base and get into a little bit more in depth on the connection between estrogen and thyroid physiology.
Yes, so, definitely. Thyroid and estrogen they play off of each other. One impacts the other, and the symptoms can be very mingled. So it's often hard to distinguish whether, just symptom based, whether you're having an estrogen issue or you're having actual thyroid problems. But when it comes to estrogen, what would you, why don't you describe the 3 forms of estrogen? Because a lot of people don't realize that there's multiple forms of estrogen. It's not just this big one umbrella of what estrogen is.
Yeah, estrogen is broken down into 3 main forms: estriol, estrone, and estradiol. And so there should be this kind of balance between the 3 of those. And we need really, when we're looking at thyroid hormones, not just look at estradiol, which is typically what most people take a look at. Mm-hmm. We really need to take a look at all 3 of those. What's even more important is we need to understand what the estrogen levels are, but we also need to understand what their metabolites look like in the body.
Absolutely.
So the primary estrogens break down into these secondary estrogens, things called hydroxyestrogens. There's a 2-hydroxy, a 4-hydroxy, and a 16-hydroxy estrogen. And these then have to go through a second phase of detoxification and go through what we call phase 2 detox, where they're kind of detoxed out of the system with the benefit of bile and end up into your GI tract, where they go through phase 3 of detox, and they get into your GI tract and go out in your stool. So one of the most important things for people who are looking at hormones is to make sure they get a good hormone test that looks at all 3 of the primary estrogens and their metabolites. That's really important when it comes to looking at estrogen physiology and the role it may play with thyroid physiology, and whether you have symptoms. If you have symptoms of estrogen dominance or low estrogen symptoms, you really need to know what all levels are.
Absolutely. And a key thing to realize is that when you have low thyroid function, you're going to favor one form of that breakdown a little bit more than the other. So your overall estrogens look good, but you may be breaking it down, a little bit differently. So getting that breakdown is really, really crucial. Plus, thyroid conversion, most of it's going to happen in the liver. So if you're metabolizing estrogens there and you're converting thyroid, if you have an underlying liver issue, you're definitely going to have effects, affecting both of those pathways.
Right. So there's problems with estrogen, right? You need a normal amount of estrogen. There's kind of this bell curve as far as estrogen goes. Too little, not good. Too much, not good. So Dr. Erica, why don't you tell everybody what some of the symptoms might be of low estrogen, and then explain what some of the symptoms of high estrogen may be.
Yeah, definitely. From a patient perspective, you want to know what signs or symptoms may you be presenting with. It might give you a little hint, especially if you don't have a test readily available to you. You can look based upon symptoms. It may not be the most accurate, but we can kind of get an idea whether you're in estrogen dominance or you're in lack of estrogen. So if you're looking at low estrogens, you could be having hot flashes. It could be mood swings. Could be depression. You could have obviously bone-related issues. You could have osteopenia, osteoporosis. It could be have painful sex. A lot of times you have vaginal dryness when you have low estrogen, especially that E2 or E3 is the big one that goes along with that, and having those low estrogens. And so big causes to why you could have low estrogen. You could be over-exercising. And so there's multiple effects of when you have over-exercise, it affects not only the cortisol, but it can lower estrogens. You may not be eating enough. So if you feel like you're gaining weight, a lot of people go into these starvation diets, and that in itself can lower estrogens even further, creating more of an imbalance as it relates to, your estrogen levels in your body.
And to some degree, when people are trying to lose weight, for years people have been told eat a low-fat diet. That too plays a major role in the body's ability to make estrogens, correct?
Absolutely. Yeah, it definitely does.
What about high estrogen symptoms? What would we expect with somebody who's got estrogen dominance or high estrogen estrogen levels in their system?
It could be, breast swelling or tenderness. It could be low sex drive. It could be bloating. You may have irregular periods. A big one that I see is headaches in the office. So that's a big common one, especially around your cycle when estrogen's going higher or lower in your body. You could have weight gain. That's a big one. And there's a lot of different reasons why people can have high estrogens. You could be over aromatizing some of your other hormones. You could have blood sugar dysregulation. So insulin drives people to make more estrogens. So it could be sugar dysregulation, overconsumption of sugar, or maybe you're consuming endogenous, estrogens. Maybe the milk that you're drinking has hormones in it from that they were giving the cows. Maybe the meats they had been feeding the animals hormones to make them fat and to plump them up so they get more meat off the animal. Maybe you're being exposed to BPAs. Maybe it's in your beauty products. That's a really big one that I see, is that anything you put on your skin gets absorbed, and if there are estrogen-like compounds in your products, you're also going to be absorbing those estrogens into your skin as well. And then you have soy and all those things that go along with the things that look like estrogens.
And simple things like plastics, right?
Yep.
Plastics, things that people use every day. Instead of maybe drinking out of glass bottles, maybe they drink out of plastic bottles that have been sitting in heat, and they've got these toxins that leak into that and can have estrogenic effects. Something really simple that people just don't think about is their drinking water, right?
Yep. Mm-hmm.
Because there's a lot of people taking estrogen hormones. When they pee those out, they go into the water supply. The water goes to this plant to get cleaned up, right? But we don't necessarily get rid of all of the chemicals, hormones, and medications that are in the drinking water.
Yep.
So definitely that can also be a source of exogenous estrogens and things that can create some challenges. So estrogen dominance, is when there's too much estrogen in the system.
Yep.
And we talked about the fact that we need to take a look at the primary estrogens, but also the metabolites, because people could have high estrogen symptoms or estrogen dominant symptoms, yet their primary estrogens could look normal or even low.
Yeah.
But those secondary estrogens build up because they can't detox those. So some of the things that may compromise or cause somebody to have elevated the elevations of their metabolites in the system would be things like decreased B vitamins and something called decreased methylation, right?
Oh yeah, that's a huge thing that a lot of people aren't methylating very well at all.
Right. And then there's simple things like gut bacteria, right, that can cause the estrogens that have gone through phase 1 detoxification and phase 2 detoxification. They can wind up with the estrogens into the GI tract, and bacteria, some bacteria in the gut produce these enzymes called glucuronidases. And those glucuronidase enzymes can then unwrap the estrogens that have been kind of detoxed and ready to go out in your poop and recycle those back into the system, which can be a cause of estrogen dominance. Yet they're not primary estrogens, so they may not show up on your blood test that you may have gotten done. but you definitely would see them on a test that would show potentially the metabolites of those things, right?
Absolutely.
So definitely gut flora can play a role, decrease in B vitamins, decrease in this process called methylation. For some people, they are into the genetics, and you and I are both into that. And there's an enzyme in the body called COMT that's important for detoxification of what are called your catecholamines, your fight or flight hormones, dopamine, epinephrine, norepinephrine, but also estrogen. So if somebody has a gene defect, what they call a polymorphism or a SNP, that enzyme is going to be slower to work. So if they have that enzyme working slower because of the SNP that they have, then estrogen's not going to be metabolized as quickly out of the system. They're going to have a buildup of those secondary estrogens, which can drive the estrogen overload or the estrogen dominant symptoms. And some of those secondary or some of those metabolites are much more toxic on the body and create a lot more damage to their tissue than the primary estrogens, right?
Absolutely. And not even to mention that thyroid function also impacts those enzymes as well, especially the CMT and the MAOI.
Correct. And so let's talk a little bit about how estrogen dominance, this overload of estrogen in the system, whether it's primary or secondary estrogens, impacts thyroid function. So there's a carrier molecule in the body called thyroglobulin, which carries the thyroid hormone around the body. Why don't you talk about what the impact estrogen has on the thyroid binding globulins?
Absolutely. Increased estrogens are going to increase the amount of those binding globulins. And so when you have increased binding globulin, it's going to bind more thyroid hormone in the system. And when it's bound, you're not going to be able to attach to the receptor and be able to get thyroid hormone inside the cell. So sequentially, you're going to have low thyroid symptoms because you have increased estrogens, which are going to cause you to have more binding globulin. So it definitely it's an indirect pathway, but it definitely impacts the ability to get thyroid hormone to those receptors and then get it inside the cell. So if your bound thyroid hormone is attached, you're not going to be able to use it in free circulation.
So if we had a woman who's got low estrogen levels on a blood test, and they're put on hormone replacement therapy,
yep.
What's going to happen to their thyroid physiology potentially by being put on a bioidentical hormone or some estrogen? What's going to happen to their thyroid physiology and potentially to their body and to their symptoms?
Well, it's going to, as you increase those estrogens, you're going to increase the binding. So you're going to get less thyroid hormone to the receptor itself, but you may not necessarily have abnormal labs because it may look good on the lab because you're not actually getting the thyroid hormone inside the cell. And this often happens with women who get put on birth control. Eventually, they develop a thyroid problem, or as their estrogens is shifting, going through menopause, they develop a thyroid problem because you're changing that free fraction amount of hormone that actually can bind to the receptors and get inside the cell. And then you start to produce symptoms when you don't get that thyroid hormone where it needs to be.
And along with estrogen increasing the thyroid binding globulin and decreasing the amount of free hormone that's available to get into the cells, the estrogen can also impact the gland, right?
Yep.
And so estrogen can inhibit something called the sodium iodine symporter. And what that actually does is increase, the symporter actually pulls iodine out of the blood into the thyroid tissue. And you need iodine to make thyroid hormone. So by taking thyroid hormone or by having estrogen dominance, you can not only have the reduced thyroid symptoms because all your thyroid hormone is bound to the carrier molecule, but your gland can actually start to become hypothyroid. You won't be able to make as much T4 and T3. And if you can't make more, if you can't make more T4 and T3, one of the things that'll happen within the gland is the gland will start to actually work harder to try and make it. And that can lead to some of the swelling and the inflammation that we see in the thyroid gland, or when people say they've got some swelling or nodules or a goiter-like effect, because their body is trying to increase the cells to try and make more hormone, but their estrogen that they took, whether it because they're menopausal or because they're trying not to get pregnant, can actually impede thyroid function at the gland and that carrier molecule, right?
Yeah. And it's funny to note is that women who go on birth control to prevent pregnancy, when they decide that they do want to have children, oftentimes they've created an underlying thyroid issue. And then when they come off their birth control, they can't get pregnant because their system is already broke. They don't know how to ovulate. Their thyroid's impacting their hormones. And it becomes this vicious cycle that happens over and over because they've taken that birth control for so long, which, destroyed their thyroid, adrenal, connection.
So if you have a woman and she's got low estrogen symptoms or high estrogen symptoms, she can get testing done. And we both recommend that if you have those symptoms, you definitely want to test hormone levels, because the symptoms of high estrogen or low estrogen can mimic the symptoms of high or low thyroid function, right?
Yeah.
It can mimic symptoms we often see with people with high or low cortisol activity. So we really want to know what's going on. We are both in agreement that probably blood tests are probably not the best test to really get a good assessment. There is a really good test we've talked about on other podcasts, and it's called the Dutch test from Precision Analytical. Why don't you talk a little bit about that test and why it's so good and how it's done?
Well, I mean, it is an amazing test, and because you're looking at all the forms of estrogen, but you're also getting your testosterone in there, and you're looking at the two forms of testosterone, because a lot of women who have estrogen issues are also going to have testosterone issues, and they make too much of the androgenic testosterone, which then are going to lead them to having symptoms that they definitely don't want. They're going to get hair in places they don't want it, lose hair in places they do want it. They're going to be moody. We're also looking at the progesterone, but we're looking at that breakdown. And a key thing talking about methylation and genetics is that on that test, it'll actually give you an idea of whether you have low methylation or you're methylating really well. And that gives you a kind of an indication whether you need to go down that path and evaluate to see if somebody's methylating well. And then on the flip side, looking at the adrenal part, you're looking at cortisol levels, and which we've talked about on other podcasts is really crucial for that, stress component in your body. If you have too much cortisol, you're going to make too much of that reverse T3, leading to more thyroid dysfunction. And so for the cost of the test and the information that you get, it's like a golden nugget. It is very, very crucial. It gives you a ton of information about underlying processes, hormone based in the body.
Excellent. Yeah, it has quickly become one of my favorite tests to do. It's, a ton of information from it, and the team at Precision Analytical is awesome, super helpful. The website has plenty of informational videos for physicians. It's got plenty of informational videos for the layperson who wants to get the test done. And it's definitely a fantastic test, and it's a great value when you want to take a look at hormones. I highly recommend that if you have symptoms and you go to somebody and they say, we're going to put you on bioidentical hormones or we're going to put you on hormone therapy, please consider getting the Dutch test done before you go on that.
Yep.
Because like we said, you may have symptoms of high or low estrogen, but your labs may tell a different story. And it's not a blood test. And that's one of the things that's maybe important to know too, is that it's a urine test.
Yep.
And so it's you don't have to go to the lab. You pick up a kit at an office like Dr. Erica's or myself. I don't know if you can order the test directly from the lab or not, but definitely you could pick it up in one of our offices. And it's a simple urine test. There's 4 pieces of paper. You urinate on the piece of paper. You let the pieces of paper dry. Once they're dry, you put them in an envelope, you ship them to the lab, and within probably 2 to 4 weeks, those results come back. If you are a man, you can take it anytime if you're having hormone issues, whether it's you have symptoms of estrogen dominance as well, or you have some problems with testosterone production. If you're a female and you're premenopausal, menopausal, definitely, you can do that one-shot test. If you're a cycling female and your cycle's off and it's irregular, that's what we talked about on a previous podcast, that you could do the cycling hormone panel, which is a little bit more involved. You have to take more samples, and you take them through the month so you can see what your estrogen levels are, all your hormone levels as you go through your cycle. That's probably a better test for the cycling female. But if you're menopausal and you're sure you're in that window, the one day test is really easy to do, and it's fairly quick to get the results back.
Yeah, it definitely is fairly quick, and it's super easy to do. That's the key, is that you don't want anything that's complicated, and you don't have to get your blood drawn, and you don't have to spit in those little vials like a lot of the adrenal and hormone tests used to be. It's a very simple test.
And the other benefit too is, along with progesterone, estrogen, testosterone, and the metabolites, they get a look at DHEA, we get a look at melatonin, we get a look at cortisol levels, which play right into this whole estrogen, thyroid, hormone balance. All those hormones interrelate. And so we get a look at cortisol levels, the amount of cortisol we're clearing out of the body or metabolizing. And that's another piece of that test that's really important, is you could have, if we're not looking at cortisol and metabolized cortisol, we may miss a really important thing, because cortisol, which is a stress hormone in the body, which can also inhibit estrogen metabolism and its clearance by inhibiting one of the enzymes called COMT, it allows us to see if we're metabolizing cortisol. And you need thyroid hormone to help metabolize cortisol. So if we get that piece on, we're getting more than just the androgens, when we're getting more than just estrogen, testosterone, progesterone, DHEA, we're actually getting what's happening with cortisol. And it just gives a much bigger picture as to what's going on, so somebody can help you out. Many times when women are struggling, and men are struggling with hormone problems, it's usually oftentimes a secondary effect of something else. And we want to be able to see that.
Yep, absolutely. Yeah, because we definitely can't forget the men, because men have a lot of estrogen issues too. People assume that it's...
How could men have an estrogen problem?
Well, most of the time they're over aromatizing, whether they have dysregulated blood sugar, and then they're taking their testosterone and they're making way too much of estrogen from that. And then same thing with the females. Maybe you're over consuming products that have estrogen-like compounds in it. Maybe your lotions or your face wash or your shaving creams, maybe they've got the estrogens in there. And men use plastic too, plastic water bottles. So those are all big things. So it goes back to those foundational things that increase estrogens.
Right. So a couple key points we want to talk about is, definitely you can't take, if you have low estrogen symptoms or estrogen dominant symptoms, you want to get good testing done. The best testing, in our opinion, is the Precision Analytical's Dutch test that can be ordered through a functional medicine practitioner's office. And you really want somebody who's knowledgeable on the test to be able to explain that test and understand the test, because it's not always as simple as looking just at what the test results are, but understanding what that really means for somebody's physiology. And low estrogen symptoms does not always mean that they need hormone replacement or hormone support. It's often we want to take a look at what's there and figure out why there's depletion, or if there isn't depletion, why those secondary metabolites are maybe a problem. So we want to take a look at those. What are some things that people could do to improve the relationship between estrogen levels and thyroid levels without testing, without really doing any additional expense? What can they do? Just natural lifestyle things that may help with estrogen imbalances or the impact that estrogen has on thyroid physiology. I
think first and foremost is, the adrenals control a lot of the hormone function in the first place. So if you're reducing the amount of stress that you have in your life. That's going to be big. Whether that's physical stress, emotional stress, a lot of the stuff that we've talked about on other podcasts, but you want a healthy diet, something that's going to be able to, you want to be eating food, not eating too little, but we'd also don't want to be eating excessive calories that you're getting insulin resistant. So, diet is very, very important for having healthy hormones. You need to be eating, to be able to make your hormones, you've got to have a backbone, of cholesterol to even to make them for most of them. And so eating healthy fats in balance with, vegetables and good sources of proteins, those are going to be big, looking at your environment. So are you getting exposed to estrogens without knowing it? Start being more conscious of looking at all your products, your lotions, your shampoos, your soaps, your makeups. Those are all big things, because you'd be surprised at what, some of the stuff that's actually in there that you could be, putting on your skin and absorbing in that could be affecting, lowering or increasing your estrogens in your body.
So cleaner diet.
Yep.
And we talked about in the past, if we broke a meal down into looking at it from a plate perspective, very heavy on vegetables, let's say half the plate vegetables, the other half of the plate, somewhere between a half and a third healthy sources of protein. The last half is primarily healthy forms of fats, and then some level of carbohydrates. And that's going to be different for everybody, right? But if your diet is vegetable heavy, some protein, some fat, you're going to be off in the right direction. Reducing processed foods and carbohydrates is probably a huge thing because of the impact it has on blood sugar. And none of that costs really anything differently than eating unhealthy, right?
Yeah.
So diet's really important. Looking at the products you talked about, and things like removing the plastics out of your life as much as possible, right? So don't microwave your food in plastic. Don't try and store a lot of your stuff in plastic. If you're drinking water every day, but you're storing it in plastic bottles and drinking out of plastic bottles, yeah, the water is awesome. Drinking out of the plastic, maybe not so good.
Yeah, and you also don't know, you may not be storing it in a hot car or in a hot place, but how do you know how that actually got to the store you bought it at? Did it sit in a hot, warehouse? Did it ride on a hot truck? You don't know the quality of it when you bought it. You may have good quality in storage than the day you bought it, but you don't know where it's been prior to that. The plastics could already be in the water.
Right, because heat is one of the things that helps those plastics leach into the plastics break down and leach into the water, right?
Yep.
So we talked about diet. We talked about removing the toxins from your environment as much as possible. A third thing that's really important is reducing, we said stress, and there's different forms of stress, but we talked about this too on another podcast, is we have to talk about sleep.
Oh, right? Gosh, yes. Yeah.
So sleep is critical, and good quality sleep is critical to reducing your stress levels. And so one of those things I really work with on my patients, and I'm sure you do too, is breathing. And I educate them during the day on breathing through their nose, not their mouth. I have them do something called the controlled hold breath time test to see how long they can hold their breath comfortably. And if that's diminished lower than it should be, then chances are pretty good that they're probably breathing through their mouth at night. And when you breathe through your mouth at night, you create hypoxia. And that's one of the things that's chronically waking you up or preventing you from getting a good night's sleep. That hypoxic state increases your stress hormones, your catecholamines, your cortisol. And again, that can cause dysregulation of your thyroid physiology, and it can cause dysregulation of your estrogen physiology.
Do you recommend your patients mouth tape while they're sleeping?
I do. And I think one of the things is because I often get people going, what? Mouth taping's pretty simple. I think some people think they're going to potentially suffocate. Not thinking like duct tape wrapped around their head. Really what I try and do is when I do a controlled hold breath test time with them, and they're less than 40 seconds, I let them know that you're probably more of a mouth breather during the day, and you have to work on some breathing exercises. And one of those things that can help them at night to sleep better, reduce their stress, is to mouth tape. And it's really simple. You just take a piece of tape. You can get 3M tape, and the tape that usually to wrap a bandage, and you can put it right across your mouth, or you can put it from top down, and it's not going to keep your mouth forced closed through the night. If you open your mouth, it can come off. But it's just there to try and limit some of that easy opening of the mouth and force you to some degree to breathe through their nose. And so I usually try and get my patients to do mouth taping, but I try and get them to start doing it during the day. So they get a little bit more comfortable with it. So I say, listen, if you're going to watch TV at night or you're going to be on the computer, put a piece of tape over your mouth so you get kind of used to it. It'll force you to breathe through your nose. And usually if they can do it during the day and they kind of get a sense of, wow, that's kind of, it's kind of awkward and hard to breathe through my nose. If it's awkward and hard to do when you're awake, you're not doing it at night. So one of the things that I really try and do is get them to do that mouth taping. And we see pretty significant improvements in people's health and function with just doing the mouth taping. So I think it's huge.
Yeah, I've seen some great results with patients. If you can get them to do it, a lot of them are like, no, I'm not going to do it. I felt like I was suffocating. They ripped it off in the first 5 minutes. And so the patients that actually, they may have to work up. Maybe the first night they only have it on there for 10 to 15 minutes, and then they have an hour, and they just keep working up. And it definitely gets easier with time, especially if you're practicing it during the day. If you sit there and you mouth breathe all day long, and of course you're going to do it during the night, so it definitely can help you get into deeper sleep. Plus, when you're sitting there mouth breathing all night, you're ruining your microbiome in your mouth, which is definitely related to your gut microbiome. So you want to be thinking about all the aspects, not even just the oxygenation part of it.
Yeah, and you change the oral microbiome, you change the nasal microbiome. There's a whole filtering system and a whole process that goes with nasal breathing. And when you open your mouth and you breathe through your mouth, you lose all that. And it's such a simple thing to work on and do. It takes some work, and especially for people who have chronic inflammation and inflammatory processes, and especially hypothyroidism. The incidence of sleep apnea with people with hypothyroidism is really pretty high. And so it's one of those things that anybody should be working on to make sure that they're improving that. If you have chronic congestion, part of the reason you have chronic congestion is because you don't breathe through your nose. You're inflamed, you're swollen, you don't breathe through your mouth, you decrease the amount of nitric oxide that's going through the nose. So yeah, it is a really important thing to do. We could do a whole podcast on breathing, but let's go to some other strategies. So we talked about sleep, we talked about reducing your stress, we talked about diet, and we talked about toxins. Anything else we kind of missed that you think we want to talk about?
I mean, you want to, not only testing the hormones itself for the sex hormones, but you also want to be looking at thyroid function, because if you start supporting all those hormones, estrogens, testosterone, progesterones, you start supporting those without looking at thyroid function and supporting that stuff, you're going to miss the boat there. You have to step back and take a look at the big picture.
And there's some people are going to say, yeah, but I need to know what supplements I need to take if I have estrogen problems. And yeah, there's things that you can take. There's things like maca and dim and chase tree berry, a bunch of things that you can use for hormone regulation. And I guess somebody may want to challenge some of those things, do some research and challenge them. But I want you to be cautious with those types of things without really knowing where your hormone levels are, because those things can really create some changes in your hormone physiology and create some damage if you're not using them appropriately.
Yeah, I've seen a lot of patients taking dim when they come in and we run their test, and they don't need to be on dim. It's the opposite. They need to definitely stop that right away, because that's not what they need at that point. It may be alleviating some of their symptoms because they're putting a Band-Aid on it, but it wasn't the right thing for them. So you can try to base things off symptoms, but it's always best to test and know exactly and have a customized plan of what you need to be on based upon your physiology.
Right. And I've got a number of women that have estrogen problems and thyroid problems, and they want to know what they can take supplementally to improve their condition. And a lot of times we'll be looking at some other things. And one of those things that I usually may start with them, it has nothing to do with their thyroid or their estrogens. I may start with their gut, because if they've that bacterial dysbiosis in those organisms that are producing higher levels of glucuronidase, all those estrogens we're trying to force through the detox process or increasing their estrogens can just be recycled right back into the system. So in the long run, we want to work downstream first, clear that out, and then support those upstream mechanisms. I don't know if you saw it. Maybe, I'm sure you probably did. The GI map test we talk about as a great tool for looking at gut function and gut physiology and what goes on in the gut just added beta-glucuronidase to the panel.
I did see that.
Which is really cool. And the first first test I got back since they changed that is a gentleman who's got all kinds of hormone symptoms. He has Hashimoto's, he's got autoimmunity. Doing that GI panel was so important for him because he wanted to know what thyroid hormone support he needed. He was already taking thyroid hormone. Nobody had done his reverse T3, which was sky high. So his Synthroid that he was getting was just getting converted to an inactive form. He's been on some hormone replacement therapy to try and regulate his hormone levels. But when we did the GI map, he's loaded with dysbiotic bacteria, autoimmune producing bacteria. He's gluten intolerant. His inflammatory markers of his bowel are elevated, and the beta-glucuronidase is elevated. So his estrogen levels, and I can't wait to see the Dutch test when it comes back, I am sure we are going to see estrogen dominance issues in him as a result of the bacteria in his gut really creating a lot of those issues and problems. So really good test. I think for the most part, Dr. Erica, I think we covered it all.
Yeah.
Let's finish up this podcast with you telling us where somebody can find you.
You can find us at brainandbodyhealthcenter.com, and that's going to be Brain and Body Health Center on Facebook, and it's going to be Doctors Riggleman on Instagram, Twitter, and YouTube. Yeah,
and so Dr. Erica always says you can find us and Doctors Riggleman.
That's me and my husband. My husband also practices functional medicine, so we're a co-team, and so we co-manage a lot of our patients. He does a lot of the structural stuff in the office and dealing with if people have joint issues, and I deal with more of the functional medicine side of it in our office. So you're getting both of us when you come for care in our office.
Yeah, so great people and a great team. If you're looking to find me, you can find me at www.chronicconditionrecoverycenter.com. You can also find me at thyroidproblemsdoctor.com. You can find me on YouTube. The Methylation Doctor, I think, is my YouTube handle. I think I'm on Vimeo too, but the Thyroid Problems Doctor is my main website for thyroid problems. So go there, learn some things. There's lots of videos posted on there. You can also Google on YouTube Thyroid Thursdays, little snippets where I talk about short 5-10 minute videos on different topics about thyroid physiology. Some of those things we expand and talk about, and we'll continue to talk about on the Thyroid Answers podcast. So we appreciate everybody who's downloading us and listening and sharing the podcast with their friends. If you could do us a huge favor, that is to go to iTunes and write us a nice review. We would really appreciate that. If you have any questions regarding anything we talk about, you can always put some questions below wherever you've watched this video. You can contact either one of us at our offices via our websites. But keep listening, keep telling your friends. If there's questions you have or things you want us to talk about, definitely reach out to us and let us know what you want to hear about and what you want to learn about, because that's why we're doing it. We're trying to give you the answers that you don't have. And thyroid problems are on the rise. It's a major problem in the U.S. and in other countries, and we're just trying to give people some answers and give them some solutions.
Absolutely.
So we're going to wrap this one up. Thank you, Dr. Erica, and thanks everybody for listening.